And as always, I'm joined by Dr. Clifford Udelman from OPTISMILE, and we are ready to take a deep dive into the world of dental care from a consumer's perspective. And now for today, it is part 3 of the sleep apnea and snoring series, so to speak. And I'm going to let Dr. Udelman introduce us to the topic there. Dr. Udelman, hello, welcome back.
Hi, Ian. Great to be back. Thank you very much. And if someone's listening to this for the first time, I do recommend you go back and listen to the previous 2 podcasts where we talk about what the difference is between sleep apnea and snoring and so on. And today is about living with sleep apnea, long-term management, and a better path to sleep. And we've got some great questions, so fire away.
So, Dr. Udelman, once diagnosed with sleep apnea, what lifestyle changes can help improve symptoms?
So we get a lot of patients that report that they snore or have a lot of apnea when they drink, for some reason, especially red wine. Also, if they take sedatives or antihistamines, if they have a lot of hay fever, the antihistamines can knock you out and your airway relaxes. Avoiding alcohol and sedatives before bedtime can maybe keep your airway more stable. Establishing a regular sleep routine and improving sleep hygiene. There's a lot of information about that. I think too much for us to cover here, but things like not watching TV or going on your phone close to bedtime, keeping the room nice and cool, and lots of fresh air and no light, so having the room nice and dark. All of these things will help you get a better night's sleep so that the next night you're not exhausted, that you're flat on your back and your throat is closing, or your tongue is falling in the back of your throat, stuff like that.
Okay, and then the question I've been meaning to ask you is, can losing weight or maybe changing your sleep positions reduce snoring or sleep apnea?
Yeah, so definitely losing weight, even 5 or 10 kgs in some cases, can actually get rid of snoring, especially if you're not very overweight. When you lose 5 kgs, funnily enough, the volume, they've done research, the tongue loses a lot of fat, the tongue gets smaller. But when you lose weight, it also reduces the fat around your neck and your throat. And that really helps open up the airways. And it also reduces severity. So if you got like severe sleep apnea and you lose weight and you keep it off, it can reduce it to a moderate, which means that you can go off a CPAP and get on a mandibular advancement splint. And like I said, even a modest reduction can improve symptoms. The other one is positional therapy. So there is sleep apnea that people get only when they're on their back, and sleeping on their side and sort it out. There's devices you can buy online, like a little shark fin or like a backpack, that when it's on your back, you can't roll onto your back. The other trick is sewing a tennis ball or something similar into a T-shirt and wearing that. So when you're on your back, it kind of digs into your back and you're not lying flat on your back. And there's also special pillows that are made to sort of keep you on your side. There's like a body pillow that you can hug, things like that. I've seen also devices being sold similar to like a bark, that when it barks, it beeps and it buzzes, it wakes you up.
Oh my word.
It was a device that you put on your forehead, like a sweatband. On your back, it would buzz lightly, not enough to wake you up, but as soon as you rolled on your side, the thing stopped vibrating, and so it just made sure you were sleeping on your side. But the home sleep study doesn't actually check position, unfortunately. I mean, I think they could include it, but it only checks a certain number of things. But when you do a hospital sleep study, they tell you how many apneas you were having on your back, or how many you were having when you're on your side or your left or your right. Do you have more questions there?
Absolutely. Quite a few, in fact. But let's start with this one. What is the success rate of long-term treatment with oral appliances for sleep apnea?
So we don't promise everyone we're going to cure them 100%, but research has shown, and in my experience, oral appliances are highly effective for patients with mild to moderate sleep apnea with success rates up to 75%. We do get patients that we make these devices for that we need to adjust them a few times and they need to get used to having their jaw more forward. It's very rare that I have a patient that says this was the biggest waste of money. I hate you. Give me my money back. People tend to love these things. Compliance is much higher with oral appliances compared to a CPAP because, like we said, they're more comfortable and more portable. And long-term success depends on regular follow-ups and adjustments. Sometimes a patient that's been wearing a device for 2 or 3 years may need the jaw pulled even further forward, especially if they put on weight. I did recently have an older patient. I made him a device in 2017, even though the OPTISMILE company warranties their devices for 2 years. They recommend you change it every 2 years. It is quite pricey. And this guy, he had one made in 2017, and it worked really well for him up until earlier this year when he injured his knee, and his main exercise to keep his weight off was walking. And he put on a lot of weight quite rapidly, and his jaw was already quite forward. So 2017 to now, he'd been wearing it for nearly, 8, still fit and everything, but it wasn't working because he put on a huge amount of weight. And I told him to have another sleep study. I wasn't going to just make him another device. And he's now on a CPAP. So that's sort of the reverse of what we were talking about.
Okay. And how often should someone with sleep apnea follow up with their dentist for treatment adjustments?
Yeah, so we see patients after 2 weeks and then as needed. Usually we don't see them again, but we do recommend they come in once a year. Need to let their jaw alignment or their bite has changed, but we don't tend to see that. If for some reason their symptoms get worse or change, then they should come back to the dentist and see what's going on. Yeah, that's about it for that question.
Okay, and then what should patients do if they don't see improvements after starting treatment?
So there are these over-the-counter devices that may work if you try them just for a few days. They boil and bite like a homemade mouth guard. Sometimes Melissa may recommend or give one to a patient just to try so that they can show their wife that this device has some promise, and they can work just for short term. But those are the ones that are implicated in moving your teeth or messing up your jaw. If they don't see improvements after starting treatment, they should definitely come back, check that the device is fitting properly. There are some dodgy devices that some dentists get their labs to make, and they haven't made many of these things, and it's a fixed device that just randomly places the jaw forward. There's no hinges or any kind of movement allowed, and then they're just kind of winging it. So those can cause jaw problems if the lab or the dentist doesn't have the experience. Losing weight, lifestyle changes, avoiding sedatives, things that we said earlier, and then a repeat sleep study to check the severity. Maybe the patient, the sleep apnea for one reason or another has gone a lot worse, and the mandibular advancement splint is no longer recommended. They need a CPAP at this point.
Okay, and can sleep apnea actually be cured, or is it a lifelong condition?
Yeah, so mild cases, and especially those that are linked to weight, can definitely be cured where you don't need any device. You just lose the weight. I have been working with a breathing coach, and I'm looking into things like mouth taping. In fact, I've got some myo tape sitting on my desk right here. It's kind of like a physio tape that you wear around your mouth, and it stops you from mouth breathing. And there's things like slow breathing and diaphragmatic nasal breathing exercises one can do, but I don't know enough about it yet. I would love to be able to sleep without apnea and snoring, and with no CPAP and no device. So, look, for most people, sleep apnea is a chronic condition, and it generally only gets worse with age, especially if you don't control it, because when you have sleep apnea, especially as a male, you're not getting enough sleep at night. So your reason why I mentioned male is you make testosterone at night when you go into deep sleep, and the sleep apnea keeps waking you up, and you don't make enough testosterone. and it's a bit of a downward spiral. You then get metabolic syndrome. You put on weight around your waist, and that messes up your testosterone further. And you start getting glucose intolerance, insulin resistance, should I say, and your glucose goes up, pre-diabetic, heart disease, all of those things. So one has to take this seriously. It's not just about snoring. Some people try surgical intervention, but there's very little that can be done surgically. Don't think I'll get into it here, but it's definitely a very last resort, if at all. Unless you have radical jaw surgery, which means moving your whole jaw forward. If you've got a very small jaw and you need that for aesthetic or orthodontic reasons, like it's called retrognathia, like a very underdeveloped jaw, in those cases, the surgery may be recommended for that, and then that could help sleep apnea. But definitely very radical to go and do surgery when something like a mandibular advancement splint or a CPAP would work. Getting your soft palate cut or your tongue lasered, things like that, I've not seen great research, and I've actually seen patients come after those types of surgeries with all kinds of problems.
Okay, and doctor, what happens if a dental appliance no longer works or the sleep apnea worsens over time?
Yeah, so like I said, in severe cases, a CPAP may become necessary. If the device is no longer effective, maybe it doesn't fit, or maybe the dentist can adjust it. It should be titratable, meaning that there's room to move it forward by putting on a shorter, in the case of the OPTISMILE, a shorter nylon connector. Sometimes if it's been several years, you may need a new device or switching to a different type of device. There's literally hundreds of internationally patented devices and then a few South African ones. So if one device doesn't work for you, a different one may work. I've had patients where I've made a device and for one reason or another it didn't work or they didn't like it, and I've gone ahead and made them a different device at no further charge. I've just eaten all the costs myself, just to make the patient happy. But yeah, nice. It does progress over time. So regular checkups and making sure that you monitor it is very important.
Okay, and let's say the oral appliances aren't enough. Are there any dental or surgical alternatives that we can look at?
So the surgery that I spoke about, the short term for it is a UPPP or a UPPP, and I'll try and pronounce it all the first time properly. It's a uvulo, so that's your uvula. Palato, that's your palate. Pharyngo, that's your throat. And then the word is plasty, which means like plastic surgery. So a uvulo-palato-pharyngo-plasty, or a UPPP, remove excess tissue from the throat. That's the one that I said a lot of ENTs overseas and maybe even in South Africa, if you see an ENT, they'll straighten your nose and they'll do that. And I can almost guarantee you'll still end up with a mandibular advancement splint or a CPAP. There's not a lot of, except in very specific cases. So I don't want to upset too many ENTs and just throw it out as a blanket statement and be unprofessional, but certainly not the first go-to. And then the other options that I mentioned, this maxillomandibular or it's bimaxillary, which is basically your upper jaw and your lower jaw, and you position all the jaws forward. It's a hectic surgery. Can take months and months, if not a year, to recover, and that sometimes is done. They're a lot more gung-ho with that overseas and in the States, especially if your insurance covers it. They'll do anything on you over there. I lived there 16 years. And then there are new devices, which I'm looking forward to perhaps even getting one myself. There's something called Inspire, which is a surgically implanted device which somehow stimulates your airway muscles to keep them open. It's like a pacemaker, but it's for your muscles and your airway. It contracts your tongue and it opens your throat it's quite radical. I did see a story on LinkedIn the other day about a patient having some device like that, and then some second device, getting implanted. It's still, I think, in its early days. I'm not sure how successful it is in the States because it's not available here. I've never really looked into it yet. So maybe in the future.
Okay, and then, how do patients actually maintain their oral health while they're using these appliances, doctor?
Yeah, so regular cleaning of the appliance. Make sure you brush it with dish soap and water. You don't want to use toothpaste on it because that can scratch it and actually make it go a bit cloudy. Your regular dental checkups to check your gums and your teeth. You don't want to lose any teeth or get any cavity. Get fillings or crowns, your device won't fit, and they are not cheap. So you really want to try and make it last as long as possible. Look, if you use a CPAP, you want to make sure you clean the mask regularly. If someone has a lot of dry mouth caused by CPAP, maybe fluoride treatments, but that's not for this podcast really. Look, it's just part of everyday life. There's not a lot you need to do that's special.
Okay, and just one more question before we wrap it up today. What advice would you give to someone who is nervous about starting treatment for sleep apnea?
Yeah, look, it's very natural to be nervous. Because we now in Movember, prostate cancer awareness. There's guys that are nervous to get a prostate exam or to do a PSA test. If you're over 40, I do recommend going to the doctor and getting it's called a digital rectal exam, and getting your PSA checked. It could save your life. I had prostate cancer over 5 years ago, and I'm 100% cured with no side effects. And obviously that's quite nerve-wracking, but untreated sleep apnea can also pose very serious health risks, including heart disease, stroke, diabetes, high blood pressure, you name it. If you Google sleep apnea and health problems, and these are very real. It's not just to scare people into coming and getting a device or going on a CPAP. It's the rate of death from untreated sleep apnea is right up there. I'm not sure how it compares to, say, prostate cancer or breast cancer or lung cancer, but certainly it's highly implicated in people with heart disease, strokes, diabetes, and so on. And, just starting with a consultation, or you can even go get your GP to send you straight to Fourie and Associates in Milnerton, or if you're in Johannesburg or elsewhere, you have to see a sleep clinic to get a sleep study, whether it's a home sleep study or a hospital sleep study. Find out what your apnea-hypopnea index is. So rather than worrying about how you're going to treat it, you first need a diagnosis, and then to rest assured that if it is on the moderate to severe and you go on diet because you've got to lose a bit of weight and you can get it down to moderate, you can just get a mandibular advancement splint or a mandibular advancement device. And many patients find once they start treatment, they quickly experience improved sleep. They've got more daytime energy. A lot of people like myself, I went out and started gym and started cycling, and my whole life improved once I went on a CPAP.
Wow, that's fantastic. Thanks for sharing your story as well with us, Doctor. And that's it for another episode of Save Your Money, Save Your Teeth, and also wraps up the snoring and sleep apnea series for it. It's been very interesting. I definitely learned a lot. Doctor, thanks so much.
Pleasure. Thank you. And like always, I hope this helps people to save their money, save their teeth, and in the case of something like sleep apnea, maybe even save your life. So I hope this episode and the previous ones helped. Great.
For sure. And also remember, while we strive to provide valuable insights with these podcasts, always consult with your own medical professional for advice tailored to your personal health. Then don't forget to subscribe to the podcast for more enlightening discussions, and join us again next week. We've got about 2 podcasts left for 2024, and then we'll continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OPTISMILE. Join us for a weekly podcast featuring Dr. Clifford Udelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OPTISMILE or book directly online on optismile.co.za. OPTISMILE, where global expertise meets local care.